Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Tarsal Tunnel Syndrome. Tarsal Tunnel Syndrome is an entrapment neuropathy. A nerve is entrapped that occurs when the tibial nerve becomes compressed or squeezed as it passes through the tarsal tunnel. So this is an example of entrapment neuropathy. The tarsal tunnel is a narrow space on the posteromedial aspect of the ankle between the medial malleolus. Medial malleolus is the lower prolonged part of the tibia, and the calcaneus underneath the calcaneus is another tarsal bone, and the tunnel is completed by the flexor retinaculum of the foot. So, the tarsal tunnel is a narrow space on the posteromedial aspect of the ankle between the medial malleolus and the calcaneus underneath the flexor retinaculum of the foot. The tarsal tunnel contains the following: tendon of the tibialis posterior, tendon of the flexor digitorum longus, tibial nerve, posterior tibial vessels, tendon of the flexor hallucis longus. Okay, so this is the tunnel. This is the medial malleolus. This is a part of the tibia. This is one of the tarsal bone. This is the calcaneus. Okay, so some structure passes through this tunnel to go to the sole. Okay, so like this is the tendon of posterior tibialis posterior, then tendon of the flexor digitorum longus, then we'll get the posterior tibial artery and accompanied by posterior tibial vein as almost like a veni comitants, two veni comitants, posterior tibial veins. This is the tibial nerve in our tarsal tunnel syndrome. This nerve is compressed. Okay, tendon of flexor hallucis longus. So these are the contents that passes underneath this retinaculum fibrous band connecting the medial malleolus to the calcaneus. This is called flexor retinaculum of the foot. This is the flexor retinaculum of the foot. So for any region this nerve is compressed, then we'll get the tarsal tunnel syndrome. Okay, like this. And the artery is the posterior tibial artery. Nerve is the tibial nerve. Symptoms of tarsal tunnel syndrome: pain. The pain may be sharp, shooting, or burning in nature in sole and heel. We know that the tibial nerve terminate into medial plantar nerve and lateral plantar nerve. This nerve supplies the muscles of the sole. So we may have pain in the heel and sole, tingling or numbness, often the sole of the foot, particularly in areas innervated by the tibial nerve and its branches, like that of the medial plantar nerve and lateral plantar nerve. Positive tinel sign: if we stroke by our finger on the tarsal tunnel over the tibial nerve, then we will get tingling, numbness along the distribution of the tibial nerve. Weakness: muscles of the foot may weaken, affecting activities like walking, standing on tiptoes, because the muscles are supplied by the branches of the tibial nerve. So if that nerve does not function, the muscle will be atrophied or non-functional, and there will be weakness. Swelling, sometimes the tarsal tunnel may become inflamed, leading to swelling around the ankle. Okay, so there may be collection of fluid, there may be tendinitis, there may be lipoma, there may be a ganglion underneath the flexor retinaculum that may lead to swelling. Causes of tarsal tunnel syndrome can vary and may include flat foot, pes planus, arch of the foot, particularly the longitudinal arch of the foot, become flattened. This can increase the strain on tibial nerve. Ankle injuries, trauma, or sprains that cause swelling can compress the nerve. Nerve means the tibial nerve. Systemic diseases, conditions like diabetes, mellitus, arthritis, or hypothyroidism can contribute to nerve compression. In hypothyroidism, there is collection of mucopolysaccharide. Okay, in arthritis, there is inflammation. In diabetes, some metabolic product may be deposited, and there will be direct nerve injury due to diabetes. Tumor or cyst like ganglia. Ganglia here means a protrusion of the synovial sheath of the tendon here. This is not a nerve ganglia. It is usually the prolongation of the synovial sheath around the tendon in a protruded manner. Varicosities of the vein and lipoma. Lipoma is a benign tumor of the fatty tissue. This can occupy space within the tarsal tunnel, squeezing the nerve. Okay, differential diagnosis: plantar fasciitis, peripheral neuropathy, local tendinitis, peripheral vascular disease like Barger's disease, and Morton's neuroma. Okay, so we can add one number here, 5. Okay, we add here a number 5. Okay, so we got that. Okay, so diagnosis of tarsal tunnel syndrome: a physical examination, pressing on the tarsal tunnel to reproduce the symptom. Pain may aggravated by eversion of the foot. Imaging studies like ultrasound or MRI may be used to visualize the tibial nerve and surrounding structure. Okay, but diagnosis is mostly clinical diagnosis. Treatment options depend on the severity and symptoms and may include rest and immobilization, giving the affected foot time to heal, medication, non-steroidal anti-inflammatory drug like ibuprofen, or corticosteroid injection to reduce inflammation and pain. Physical therapy, exercises to strengthen and stress muscle as well as to improve foot posture. Orthotic devices, custom-made shoe inserts to support the foot and relieve pressure on the nerve. Surgery: in severe cases where conservative treatment fails, surgery may be considered to decompress the tibial nerve. We like to release the pressure underneath the flexor retinaculum. We may cut a part of flexor retinaculum and clean the soft tissue under the flexor retinaculum and repair the flexor retinaculum. And that's all about the tarsal tunnel syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.